Hello, my name is Madeline Spencer, and I am doing my presentation on child life. Before we start, I want you to think about how it felt when you were younger and always being told what to do, how to do it, and when. Whether it be folding clothes, getting ready for bed, or even just your daily day-to-day routine. Now, imagine yourself being put into a scary, intimidating environment, surrounded by doctors in masks, your parents, and no one is there to talk to you as you try to process what is happening. And that is exactly what child life specialists are here for. Child life specialists are here to prepare the child for hospitalization, medical procedures, to advocate for the child, provide guidance and material for play, provide emotional support for the child and family, and to create and maintain a positive, safe, and receptive environment. Today we are going to be talking about my main question, research findings, how to apply those findings, and what research is still needed. My main question is, what are the benefits of medical play for children who are going through or preparing for treatment in the hospital? But first, let's discuss why I chose this question. Meet my little bestie, Quinn. I have been a nanny for her family since before she was born. After her 1-year-old checkup, she became afraid of the doctor's office, and for her 2nd birthday, I bought her a Peppa Pig doctor's kit. She became obsessed with it, and we played with it together, and she even took it with her to her 2-year-old checkup, where the doctor let her use it. And ever since then, she hasn't been afraid, and she's been excited to go to the doctors. This all happened before I even knew what a child life specialist was. I wanted to dive deeper into learning exactly how medical play affects children going through treatment, and children going through treatment that is a little bit more complex than just a simple doctor's checkup. Medical play is play where the child and parents are encouraged to play with real medical equipment and supplies in order to prepare the child for their upcoming procedure by exploring basic equipment such as a thermometer, oxygen mask, and syringes. By using medical-themed child-directed play, which can offer mastery and control over frightening medical equipment and including role rehearsal, indirect medical play, and medical art. Now let's watch a video of a child life specialist using medical play in action.
Do you see those lines in my hands? You know those ones?
Yeah.
Yeah, you have some in your hands? Let me see. Oh, you have some in your hands too? As a child life specialist, part of our job is meeting kids where they are and making sure that anytime they come to a hospital, they still have opportunities to play and be normal. What do we usually do before pokes?
So how do you usually get ready for pokes?
Take a deep breath. Take a deep breath, Teddy.
I'll bring in a doll, try and mimic some of the same types of injuries that the child may have and individualize it for them if they are old enough to kind of understand that concept.
You think your teddy bear's okay? I don't think he
He's
didn't even
okay.
cry.
He didn't move and he didn't cry.
Yeah, just like me.
Yeah? You mean you could do exactly what your teddy just did?
Yes.
We count to 3, okay? Ready?
Pay attention.
1, 2, and 3.
Keep going.
There you
Just
go.
good job.
Awesome. Good breathing. All right.
I'm really proud of you doing that IV
Thanks.
and for knowing exactly how to do all of the steps on the bear.
Thanks.
Medical play can help children by giving them a safe space where they are free to express their feelings and understand what is happening by giving them an opportunity to ask any questions that they have, and for the care team to be able to clear up any questions or misunderstandings that the patient has. It also helps reduce the anxiety about medical tests and procedures, and it also helps the child and parent adjust to being in the hospital. Although it is challenging to find exact statistics, There have been many studies that have shown the dramatic effects that medical play has on the child. Play is highly therapeutic for ill children, and it leads to better physical and emotional well-being, which can lead to a faster recovery. It also leads to a decrease in negative feelings towards the hospital, staff, and procedures. Through the understanding of play, healthcare professionals can accurately understand the effects of hospitalization and disease on children on the one hand, and on the other hand, enhance the emotional development of children. Through the use of play, they have the chance to gain control in many situations, thus changing hospitalization into a positive rather than a negative experience. They must choose the appropriate activities which help the children grow, while encouraging the parent to bring the child's favorite toys to the hospital and to actively take part in the entire procedure. For infants and toddlers, we focus on their exploratory and sensory motor needs. These needs can be explored through exploring medical materials like gauze, tape, or gloves. You can also have the parent role play that they are the patient and have the child check their heart rate or their temperature. At this age, they would also love to have a doctor bag that they can bring with them to checkups or that they can use on their favorite stuffed animals or dolls. And then you can also allow them to play with Band-Aids, which is also great for their fine motor skills. For preschool-aged children in the hospital, the main focus shifts to fantasy and creative play. The child can pretend to be the doctor, act out medical situations, dress up in scrubs, and work on calming techniques, all under the guise of play. For school-aged children and adolescents, the focus shifts to allowing the child to feel more in control in the hospital setting. Some mastery and control focus play that the child and the child life specialist can do includes role-playing with real medical tools and allowing them to make their own schedule and to create their own coping plans. For skill building, you could have one of the older children try to teach a younger child about getting ready for a procedure that they might have already gone through. They can also make artwork out of medical equipment and play hospital-related games such as Operation. In order for the child to stay connected with peers in the hospital, the child life specialist can set up medical pen pals with other hospitalized kids, group medical play sessions, and even online games if the children can't be in the same room together. One research question that we mentioned in class that is still necessary is examining the prevalence of adult-directed play at the expense of child-initiated play within the field of child life. This could mean exploring questions such as, how do children react towards adult-directed play versus how they react to child-initiated play? Exploring reasons behind when and why adult-directed play is used. Is it due to time restraints or lack of training, etc.? And study exactly how much play in the hospitals are adult-directed rather than child-directed. In the United States, there are over 2 million children that are admitted to the hospital every year. 35 to 62% of those children are reported having PTSD symptoms after extended stays at the hospital. And 7 to 40% of those children also have symptoms of either depression and/or anxiety. And lastly, I wanted to share this quote from L.R. Nost, in which she says, "When little people are overwhelmed by big emotions, it is our job to share our calm, not join their chaos." Thank you for listening.